respected chairs, scientists, researchers, all the participants joining here and virtually. So on behalf of the team, I would like to present on multisectoral coordination for health from the perspective of 3 provinces in Nepal in the current federalized context. So just to start with the context, health is a multidimensional issue. So we have been hearing this morning that so many different social and economic factors are affecting health, and there are so many social determinants we are talking about in relation to health. And health system functions in a changing political, administrative, and social ecosystem, which again interfaces with multiple other sectors. So there is growing importance of multisectoral coordination and collaboration for promoting health, reducing disparities, addressing interconnected health issues that are growing over time, as we see. At the same time, there is opportunity through multisectoral coordinations to pool the resources, expertise, knowledge, and tackle complex and interconnected issues across the sectors. Despite this recognition and importance that has been highlighted in the literature, there is gap in the evidence in terms of current practices and coordinations, particularly in our context. So to bridge this gap, we assessed the current landscape, including facilitators, challenges, and opportunities of multisectoral coordination at municipal level in the current federalized context of Nepal. So this study was a qualitative exploratory study. The 3 municipalities were focused mainly from Gandaki, Lumbini, and Karnali, and 25 key informant interviews were conducted. Data were transcribed and analyzed thematically. In terms of findings, as we see at the municipal level, there is local health systems where there are political actors led by, for example, mayors and deputy mayors, but besides that, there is a holistic team, municipal council, ward chairs, ward members who basically engage in shaping the policy and planning framework for the sector as well as resource allocation. And there is more managerial actors and sections, departments, structures who interact with these political actors. Health is one of the core within that structure. And health interplays with multiple sectors within that framework, which basically play a role in terms of managing health service delivery and performing the public health functions. These actors interact. There is also, health facilities are there in terms of hospitals, basic health service units. There is also HFMC who manage the operation of the health facilities. There is interaction with the community actors. We talked the story, we listened the story of these FCSBs, and there are also mothers groups, so many other community groups. Besides that, there are also federal and provincial actors, so many actors working in the systems for the benefit of the people. In terms of current situation of the multisectoral coordination, where we did focus, there were no long-term plan which could potentially bring multiple actors together in terms of shaping the sectors better, working for the people's health. Also, there were few sectoral policies and strategies which, however, we are not really or genuinely informed by the local evidence. They were adopted based on other contexts, other scenarios. So even whatever has been done, that was not really based on the local priorities that was mentioned by the respondents. Similarly, there were a provision of regular meetings and coordination across the multiple actors. However, that was not routinely happening the way it should be happening. As a result of that, multiple actors working within the municipal settings were not really informed about each other. So there was limited scope for them really to coordinate and collaborate across the sectors. Similarly, to a certain extent, it's not like collaboration was not happening at all. Collaboration was happening to a certain extent between the sectors. For example, health and education, health and WASH. For example, school health is one of the excellent examples where health and education are interacting. There are also waterborne diseases where multiple actors are working together. However, besides that, there are also some sections or structures who could potentially, such as planning and finance, like structures within the municipal settings who can bring different actors together. For example, planning sections within the municipal level interacts with all other sectors. Similarly, finance sections is the one which is the center for all others. But that structures had not really been able to effectively coordinate other sectors to really make it happen in terms of collaborative work. Thematic committees usually meet during the planning process, not throughout the implementation phase. That limits the scope of delivering work in a collaborative manner. Despite of these issues and challenges, context, still there is a felt need that focus should be on the collaboration and implementation should be in a collaborative manner. When we go beyond the municipal setting and look with the other actors who interact with the municipalities, there was also no formal structure for sharing and learning with other local governments, for example, provincial actors and other CBOs and local organizations. Within the health sectors, district health offices were playing a crucial role in terms of facilitating interaction with them across the municipalities, as well as linking provinces and federal actors with the municipalities. Similarly, there are also other external organizations working within the municipal settings or districts. However, initiations in terms of bringing them together was mainly initiated by external actors rather than within the municipalities, meaning that it was not intentional within the municipal setting, but it was somehow happening. So, in terms of provinces engaging at the municipal level, they were with limited resources to engage with the municipalities, so it created limited opportunity to really facilitate the collaboration across the actors to make the health sector work in collaboration. So barriers for effective multi-sectoral coordinations, there are no routine mechanism, structured mechanisms to have the sectors coming together and work. District level provinces offices realize that local authorities have power and authorities, and they also are with limited capacity, but they hardly seek expertise or technical assistance to make it happen. Also, geographically, sometimes barrier was like offices were isolated. They were sitting in different places. If they were together, that could have provided even informal opportunity to collaborate. There was due to limited structure, guidance, and orientation on multi-sectoral coordination, that was acknowledged as also as the challenge for the multi-sectoral coordination from the health sector perspective. There are multiple actors and limited capacities, which we can see in this slide. When we see the health sector budget, Ministry of Health, for example, at the federal level with multiple actors, was slightly more than 50% of the budget. Other actors are also there. So within the health sector, there are so many actors we can see which need to coordinate and collaborate with multiple other sectors. But that is not, I mean, for that purpose, we don't really have capacity at the local level. In terms of local self-assessment capacity, the weakest area is collaboration and coordination, where optimal is 100, only around 1/3 capacity is there in the system. This final slide, collaboration for planning and actions occurred only sporadically at the local levels, which was mainly driven by the specific needs or case-by-case basis. Sectoral coordination outside the municipal offices was also functioning mainly from the annual planning process rather than going throughout the implementation phase. Similarly, although stakeholders were found engaged with other sectors, sometimes on a personal basis, sometimes on informal arrangement. There were positively, there were pockets of programmatic collaboration, such as nutrition. However, these were not being tapped or utilized as an opportunity to move ahead with the multi-sectoral collaboration to really minimize the issues of health sector that we have been seeing throughout these 3 days. Thank you so much.